Okay, we are live now.
No. Hello, everyone. Good morning, good afternoon, good evening, wherever you are around the world. Um, it's a great pleasure to me to be here today with Dr. Obeid. Dr. Obeid is a medical doctor with a specialization in orthopedic surgery at the Beirut Arab University. He has his master's degree in business administration, public health management in 2015. And he's also PhD in osteopathic clinical sciences. Dr. Obeid, he is faculty from the Department of Biomechanics and Traumatology at Global University in Lebanon. He is also head of the Department of Orthopedic Surgery in Faken in Lebanon and head of the Municipal Health Committee. He has a large experience with stem cells and ozone therapy. And also, he is a member of Ozone Society, member of the Lebanese Order of Physicians, member of International Society of Stem Cell Application, ISSCA. Today, his lecture is about the potential use for COVID-19 treatment and all coronaviruses. Thank you so much for your presence today with us, Dr. Obeid, and I hope you enjoy this time with us. Thank you so much for spending your time with us today. And I hope, I know that everybody will like to listen you in your lecture today, this time for me morning, for you probably at night, and the floor is yours. Doctor?
Yes. Hello,
Can you hear me?
Yeah.
Yeah.
Hello,
the floor
Dr.
is yours.
Thank you. Thank you. Hello, everybody. Good evening, good morning, and good. It's time now, 9 p.m. in Beirut. So hello for everyone watching us. Yes, Dr. Carlos, can I begin the lecture or you?
Yes. Or please, if you can, how's the situation of coronavirus right now in your country?
Yes, it's better. It's better now. We have only about today was 171 patient case and with 5 dead patient. 2 months ago, it was very epidemic and we complain of a huge number, more than 5,000. But the Minister of Health here work as a good part in controlling for the COVID pandemic in Lebanon.
Awesome. And the vaccination, the people, they are accepting the vaccination, or they are not accepting the vaccine from the government?
Yes, they accept a lot of people. They accept the vaccination, and as you know, all people thinking about the complication and what the rumor says about the vaccine and its complication. But the Minister of Health here play a big role in in distribute the vaccination in all region of the country. And also till now, I think it reached about we will not reach till now half a million, but we are a small country. We only 6 million in Lebanon.
I see. I see. So I'm very, very curious to see your lecture. Thank you so much for presence today with us. And yeah, you can start your lecture, Doc. Thank you so much.
Thank you, Dr. Carlos. So again, hello, ladies and gentlemen. Our topic today is about ozone autohemotherapy as a potential use in COVID-19 treatment because of its possible mechanism of antiviral action and antioxidative. At the beginning, we should explain what is the ozone. The ozone is a colorless gas composed of 3 atoms of oxygen. It is considered one of the most potent oxidants in nature. Ozone was first discovered by chemist Christian Friedrich Schoenbian in 1840 as a disinfectant. Ozone is an elemental form of oxygen occurring naturally in Earth's atmosphere. Medical ozone used to disinfect and treat disease has been around for over 150 years. Ozone therapy has been in use since the 18th century, and in the 1896, the genius Nikola Tesla patented the first ozone generator in the US. During the First World War, doctors familiar with ozone's antibacterial properties and with a few other medical resources available to them applied it topically to infected wounds and discovered ozone not only remedied infection but also had hemodynamic and anti-inflammatory properties. The medical generator of ozone produces it from pure oxygen passing through a high voltage gradient, a gas mixture comprising not less than 25% oxygen and no more than 5% ozone used in medicine. This gas is named medical ozone. So the minimum percentage of 0.05% of ozone give us 1 microgram per milliliter in ozone oxygen therapy, and the maximum dose, which is 5% ozone, give us 100 microgram per milliliter ozone in oxygen. The benefits of ozone. The primary action of ozone therapy include increased oxygen efficiency, immune modulation, mediated oxidative stress, improved microcirculation, and some people often report increase in energy, cognitive function, and endurance, and decrease in pain. So we have many common ozone therapy applications, which the first one is rectal insufflation by infusion ozone rectally, topical ozone for open wounds, major autohemotherapy, which is removing blood, ozonating it, returning it to the patient, or major ozone, or we can consider ozonated normal saline as a major autohemotherapy. Minor autohemotherapy, which is remove a small amount of blood, ozonated it, inject it into muscle. And we have ozone sauna and limb bagging ozone therapy. Does ozone treat diseases? Ozone therapy treats a lot, but cures nothing. It has a fundamental action to the body, which allows the body to rebalance and heal itself. Here in brief, the action of ozone, it has antimicrobial agent against bacteria, fungi, protozoa, and viruses, antioxidant capacity, enhance of the immune system, release of growth factor, expression of adaptive inflammatory responses, induces synthesis of interleukin and leukotrienes, secretion of vasodilators such as nitric oxide, activation of aerobic processes like glycolysis and Krebs cycles. In brief, also ozone benefit, pain reliever, improves tissue oxygenation, increased metabolism, anti-inflammatory, anti-aging, cellular regenerator, germicidal effect, immune system stimulant and antioxidant, and improved circulation. Now we should talk about the coronavirus also in brief. Coronavirus are lipid enveloped positive stranded RNA viruses with a crown-like appearance under an electron microscope due to the presence of spike-like protein on the envelope. Coronaviruses are a large family of viruses that cause illness ranging from the common cold to more severe disease such as Middle East respiratory syndrome, MERS corona, and severe acute respiratory syndrome, SARS corona. Coronavirus disease, COVID-19, is an infectious disease caused by a newly discovered coronavirus. Coronaviridae family classifies into 4 genera of corona: alpha coronaviruses, and beta coronavirus, and delta coronavirus, and gamma coronavirus. Human coronavirus divided in common human coronavirus like H coronavirus OC43 and H coronavirus HKU1, which are beta coronavirus, and H corona 229E and H coronavirus NL63, which are alpha coronavirus. These viruses can cause common cold and self-limiting upper respiratory tract infection in immunocompetent individual. Other human coronaviruses like SARS corona and MERS corona, which belong to beta coronaviruses, which of B and C lineage respectively. These viruses are considered to be more virulent and capable of causing epidemic, manifesting with the respiratory and extra-respiratory manifestation of variable clinical severity. SARS-CoV-2 or COVID-19. SARS-CoV-2 is a novel beta coronavirus belonging to the same subgene as severe acute respiratory syndrome corona SARS-CoV and the Middle East respiratory syndrome coronavirus, which have been previously implicated in SARS coronavirus and MERS coronavirus epidemic, with mortality rates up to 10% and 35% respectively. It has a round or elliptic and often pleomorphic form and a diameter of approximately 60 to 140 nanometer. Like other coronavirus, it is sensitive to ultraviolet rays and heat. These viruses can be effectively inactivated by lipid solvent, including ether, ethanol, chlorine-containing disinfectant, peroxyacetic acid, and chloroform, except for chlorhexidine. Although the origin of SARS-CoV-2 is currently unknown, it is widely postulated to have originated from an animal implicated zoonotic transmission. Genomic analysis suggests that SARS-CoV-2 probably evolved from a strain found in bats. The genomic comparison between the human SARS-CoV-2 sequence and known animal coronavirus indeed revealed high homology, about 96% between the SARS-CoV-2 and the beta-CoV RATG13 of bats. A released report by the WHO describing the possible origin of SARS-CoV-2 was inconclusive, as it did not clearly specify the origin of the virus. However, it did report that the circulation of SARS-CoV-2 occurred as early as December 2019. This report explored several possible hypotheses of the origin of the virus that included the origin of the virus in an animal, the transmission of the virus to an intermediate host, and subsequent passage into humans. Structurally and Phylogenetically, SARS-CoV-2 is similar to SARS-CoV and MERS-CoV and is composed of four main structural proteins: spike, envelope, glycoprotein, nucleocapsid, and membrane. The surface spike glycoprotein, which resembles a crown, is located on the outer surface of the viron and undergoes cleavage into an amino N-terminal S1 subunit, which facilitate the incorporation of the virus into the host cell, and we have carboxyl C-terminal S2 subunit containing a fusion peptide. The transmembrane domain and cytoplasmic domain is responsible for virus cell membrane fusion. The S1 subunit is further divided into a receptor binding domain RBD and N-terminal domain, which facilitate viral entry into the host cell. The RBD is a fundamental peptide domain in the pathogenesis of infection, as it represents a binding site for the human angiotensin converting enzyme 2 receptors. Here we have the shape of the virus. We have the spike glycoprotein S, we have a E protein, membrane protein M, and RNA genome inside the virus, and we have the envelope. Here we have the spike, the S1 part, which are receptor binding domain to angiotensin converting enzyme receptor. Here we have a binding and viral entry via membrane when the cell is interacting with the receptors and enter the membrane and replicate in the cells. Symptoms of SARS-CoV-2 or COVID-19. Symptoms of COVID-19 are variable but often include fever, cough, headache, fatigue, breathing difficulty, and loss of smell and taste. Symptoms may begin 1 to 14 days after exposure to the virus. At least a third of people who are infected do not develop noticeable symptoms. Of those people who develop noticeable symptoms enough to be classified as patients, most 21% develop mild to moderate symptoms up to mild pneumonia, while 14% develop severe symptoms like dyspnea, hypoxia, or more than 50% lung involvement on imaging. And 5% suffer critical symptoms like respiratory failure, shock, or multi-organ dysfunction. Also, older people are at high risk of developing severe symptoms. Some people continue to experience a range of effects long COVID for months after recovery, and damage to organ has been observed. Multi-year studies are underway to further investigate the long-term effect of the disease. Here we have the SARS when it entered through nasal pathway or mouth. Virus enters oral or nasal to reach the respiratory cell. Then virus enter epithelium, and then virus fuses with the vesicle and its RNA is released. Virus assembly, virus released and go out from the cells, and virus ingested by antigen presenting cell APC, which will start the immune response. Cytokines release syndrome or cytokine storm. In reality, it's the main problem in COVID-19 disease, because all the failure or the problem in the lung appear due to the cytokine storm. People with the severe COVID-19 have symptoms of systematic hyperinflation or cytokine storm. Clinical laboratory finding of elevated of interleukin 2 and interleukin 7, interleukin 6, granulocyte macrophage colony stimulating factor, interferon gamma induced protein 10, monocyte chemo attractant protein 1, macrophage inflammatory protein 1 alpha, and tumor necrosis factor. Indicative of cytokine release syndrome, suggests an underlying immunopathology. Here we have the process and the presentation of SARS-CoV when react with the APC and start to the immune process and inflammatory process, and these cytokines which may lead to cytokine storm, and the patient will suffer. COVID-19 vaccine have been authorized for emergency use by the FDA, and vaccination program are in progress across the US and in many parts of the world. But the question is, what if we have a new virus, coronavirus, and if we handle the economic and epidemic problem? So because that, we should thinking in other way to treat like these viruses rather than the vaccine. So in potential use in COVID-19 treatment, ozone versus COVID-19. Ozone, because of its special biological properties, has theoretical attribute to make it a viable candidate as a COVID-19 inactivator and treatment of oxidative stress in lung through a variety of immunological mechanisms and dose dependent. By reacting with polyunsaturated fatty acid and water, ozone creates hydrogen peroxide, a reactive oxygen species. Simultaneously, ozone forms a mixture of lipid ozonation products. The LOP created after ozone exposure include lipoperoxidyl radicals, alkenols, and 4-hydroxynonenal. Moderate oxidative stress caused by O3 increases activation of the transcriptional factor mediating nuclear factor erythroid-2 related factor 2, which known as NRF2. The NRF2 domain is responsible for activating the transcription of antioxidant response element. The antioxidant created include but are not limited to superoxide dismutase, glutathione peroxidase, glutathione S-transferase, catalase, heme oxygenase 1, quinone oxyreductase, heat shock proteins, and phase 2 enzymes. So ozone autohemotherapy can consider as potential treatment in COVID-19 because of its antiviral effect. Secondly, because it is modulate oxidative stress and cytokine storm in the lung, and also it improves blood rheology, oxygen delivery, and oxygen utilization. We will discuss about the antiviral effect of ozone therapy. In vitro, ozone has been shown to interfere with the virus to cell contact in lipid enveloped viruses via oxidation of lipoprotein, proteins, and glycoprotein, thus interfering with the viral reproductive cycle. In vivo, ozone therapy has been shown to have a multifaceted effect when interacting with polyunsaturated fatty acid. So H2O2 radially diffused into immune cells has been shown to act as a regulatory step in signal transduction and increase of immune responses. The oxygen, the O3 damage the viral capsid and upset the reproductive cycle by disturbing the virus to cell contact with peroxidation. Pucci and colleagues have thoroughly investigated the ability of ozone to induce cytokines. Interferon gamma could be induced from human leukocyte by ozonation at rather low concentration. Interferon gamma is the key cytokine that mediates antiviral activity of the immune system, mainly by enhancing the activity of natural killer cells, which can also recognize and lyse tumor cells independently of major histocompatibility complex restriction. Here we have the interaction between the spike protein with the ACE receptor as a normal receptor leakage. But when this spike protein react with ozone, it will change the shape of the spikes and will impair receptor linkage. Oxidative stress and cytokine storms can be corrected by using ozone therapy in high dose. Ozone therapy induces a series of graduated small oxidative stress acting on all organs and able to reactivate the potent defense system, which counteract the chronic oxidative stress. Oxidative stress and cytokine storm can be corrected by using ozone therapy in high doses. Because the real molecular mechanism of antioxidant activation, alkyl addicts are able to react with the KIAP1 and NRF2 system that is present in the cell stall with the role of antagonizing oxidative and electrophilic insult. In detail, KIAP1 is a protein molecule with many SH groups that are important for the repression of NRF2 activity. The alkyl interaction with both cis 272 and 288 of KIAP1 allows the release of NRF2, which escapes proteasomal degradation and translocate into the nucleus and bind to the antioxidant response element on DNA. On this basis, it is clear that NRF2 is now correctly recognized as the key cellular defense system against oxidative and xenobiotic stresses. The reactivation of innate defense system leads to the synthesis of a number of antioxidant enzymes able to counteract the chronic oxidative stress. By activation of the gamma-glutamyl cysteine ligase and of glutathione synthase allows a marked increase of the glutathione intracellular level. The enhance of G-glutathione per glutathione reductase ratio allows an important protection against ROS. Activation of the synthesis of antioxidant enzyme able to detoxify an excess of ROS such as catalase, superoxide dismutase, glutathione preoxidases, and glutathione reductase. The upregulation of heme oxygenase 1 is also very protective, and the trace of carbon oxide in combination of nitric oxide allow vasodilatation of ischemic tissue. Also, we have the enhancement of the synthesis and level of phase 2 enzymes such as glutathione S-transferase, N-acetyl transferase, and sulfotransferases. And also we have inhibition of cytokines mediated inflammation via the induction of leukotriene B reductase, reducing iron overload and subsequent oxidative stress induced via elevated ferritin and bilirubin as a lipophilic antioxidant. Now we will talk about ozone's effect on blood rheology, oxygen delivery, and oxygen utilization, endothelial nitric oxide production. Ozone therapy causes an increase in the red blood cells glycolysis rate. This leads to the stimulation of 2,3-diphosphoglycerate, which leads to an increase in the amount of oxygen released to the tissue. Ozone activates the Krebs cycle by enhancing oxidative carboxylation of pyruvate, stimulating production of ATP. Production of prostacyclin, a vasodilator, is also indeed by ozone. Ozone-induced HO upregulation could modify nitric oxide production and alter vasodilatation. Because we're talking about ozone autohemotherapy, we should know about the biomechanical reaction of ozone with the blood. It must be clear that ozone in itself cannot exist in the circulation, and moreover, due to the potent antioxidant capacity of plasma. We have here radicals with water and ozone give us H2O2. As H2O2 is unionized, it freely diffuses into all blood cells, although the bulk is mopped up by erythrocyte. The increase of H2O2 resulted in a progressive rise of almost all glycolytic enzyme activity, especially those of aldolase. It increased about 200%, phosphoglycerate kinase 140%, phosphoglycerate mutase 136%, pyruvate kinase 130%, and glutathione peroxidase 130%. What is the action of ozone on the blood? That we start about erythrocyte. Probably the activation of phosphofructokinase accelerated glycolysis with demonstrated increase of ATP and 2,3 DPG. Only repeated therapeutic sessions may allow LOP compounds to react the bone marrow and activate a development at the erythropoietic level, favoring the formation of a new erythrocytes with improved biomechanical characteristics. The therapeutic advantage does not abruptly stop with the cessation of therapy, but rather persists for 2 to 3 months. Here we have the reaction between ozone and the radicals, which interfere in the Krebs cycle, which lead to increased ATP and give us transport 1,3 DPG to 2,3 DPG, which react with hemoglobin and lead to increased oxygen in tissue. Here we have the Bohr effect that in ozone therapy tend to the right side because of its increase in DPG, which is useful for patient to increase oxygen saturation in organ and not lead to organ failure. We have also hemorrhagical effect of ozone treatment. All we know about RBCs repels each other because of their negative surface charge from sialic acid residues. At the same time, they are attracted by the van der Waals forces. The balance of these two forces determine the most stable arrangement of red cells in an electrolyte solution in the absence of the other forces. The cellular purposes of RBC determine the cell's intrinsic tendency to aggregate. Ozonation is known to increase the negative charge of the RBC's membrane. Following 15 days of treatment with ozone, we observed a prominent decrease in RBC's aggregation. Now we will talk about the effect of ozone in leukocyte. Neutrophil phagocytic activity have been found enhanced during ozone therapy. H2O2 activates a tyrosine kinase with subsequent phosphorylation of I-kappa B protein, IKB, one of the primary components at rest of the transcription factor denominated NF-kP. The phosphorylated IKP detached from the trimer and it is broken down in the proteasomes. The remaining heterodimer P15 and P65 is transferred into the nucleus, where it can activate about 100 genes up, regulating the synthesis of acute phase protein, several pro-inflammatory cytokines like interferon, gamma, tumor necrosis factors, and interleukin 8, and even HIV proteins. Although ozone is a very modest inducer of some cytokines, the consequent immunomodulatory effect may be useful in immune-depressed patients after chemotherapy or in a chronic infectious disease. Here we have the effect of COVID-19 in increasing inflammation and also in increasing oxidative stress. And oxidative stress and inflammation will lead to cytokines storm. Ozone therapy will decrease cytokines storm by decrease inflammation and decrease oxidative stress and increase NRF2, which decrease the NF-kP. Also, we will talk about the action of ozone in blood in platelets. During ozone autohemotherapy, we detected increase in platelet-derived growth factor subunit B, transforming growth factor beta 1 and epidermal growth factor EGF. Now we will talk about, or we always ask a question about, does ozone therapy have a scientific support? Ozone therapy research beyond COVID-19 continues to advance. Currently in Medline database PubMed, there are 3,329 documents related to ozone therapy, of which 251 are clinical trials, 169 randomized controlled trials, 24 of systematic review, and 8 meta-analysis studies, which support the use of ozone in medicine. In addition, there are 37 registered studies for ozone therapy on clinicaltrial.gov, which is database of clinical trial at the U.S. National Institute of Health. The WHO has published in its virtual library COVID-19 global literature of coronavirus disease 3 following investigation on ozonated saline solution and COVID-19. The first one was complementary application of the ozonated saline solution in mild and severe patients with pneumonia COVID-19, a non-randomized pilot study done by Schwartz, Adriana et al. And the second one was potential cytoprotective activity of ozone therapy in SARS-CoV-2 COVID-19, done by Martinez and Schwartz et al. Potential use, the third one was potential use of ozone in SARS-CoV-2 COVID-19 ISC ozone, Schwartz, Martinez, which are International Scientific Committee of Ozone Therapy. Now we will talk about some articles that published in literature talking about the result and the conclusion of these studies. The first one is a pilot study for treatment of COVID-19 patient in moderate stage using intravenous administration of ozonated saline as an adjuvant treatment registered clinical trial. The conclusion was resolved clinical symptoms, improved oxygenation, clearance of infiltrate on chest X-ray, and an improvement in biomarkers in a short period with a non-progression of the disease showed that IV ozonized saline therapy was safe and effective to prevent disease progression in COVID-19, making it an effective novel therapeutic tool. Also, we have compensate use of rectal ozone in severe COVID-19 pneumonia, a case control study. The conclusion was compensate use of rectal ozone improved O2 saturation, improved O2 saturation, reduced O2 supply, decreased inflammation, biomarkers, and improved Taylor radiological scale with statistical significant difference when compared to standard of care in patients with a severe COVID-19 pneumonia. Also, we have an article titled as COVID-19 and ozone. The conclusion was systematic ozone application may be useful as a treatment method for COVID-19. Furthermore, larger clinical studies are needed in the future to verify the use of ozone in complementary therapies for COVID-19. Here we have effectiveness of ozone therapy in addition to conventional treatment on mortality in patients with COVID-19. The conclusion was, in this study, the finding suggested that the administration of ozone therapy along with the conventional medical treatment in patients hospitalized for COVID-19 could reduce mortality. We have article titled as intravenous ozonized saline therapy as prophylaxis for healthcare worker in a dedicated COVID-19 hospital in India, a retrospective study. Conclusion was IV ozonized saline can be used in addition to standard prophylactic regimen for the prevention of COVID-19 in healthcare workers. Prospective larger studies are required to establish the potency of IV ozonized saline as a prophylaxis. Also, we have ozone therapy for the treatment of COVID pneumonia, a scoping review. The conclusion was ozone therapy could be a potential resource to modulate the patient immune responses against SARS-CoV-2, contributing to contain the cellular oxidative stress of COVID-19 pneumonia and breaking the vicious cycle of cytokine storm observed in severe form of the disease. Ozone therapy may also be useful complementary treatment to consider in patients suffering from early-stage COVID-19 pneumonia to prevent the progression to life-threatening disease. Also, we have titled the article Ozone Therapy in COVID-19, a narrative review. Systematic ozone therapy seems useful in controlling inflammation, stimulating immunity, and as antiviral activity, and providing protection from acute coronary syndromes and ischemia reperfusion damage, thus suggesting a new methodology of immune therapy. Systemic ozone therapy in combination with antiviral in COVID-19 positive patient may be justified, helpful, and synergic. Here we have a titled article as safety and efficacy of ozone therapy in mild to moderate COVID-19 patient, a phase 1 to 11 randomized controlled trial study. Conclusion was ozone therapy, when integrated with standard of care, can improve the clinical status and rapidly reduce the viral load compared to standard of care alone, which facilitate early recovery and check the need of advanced care and mortality as demonstrated in this study. Summary and conclusion. COVID-19 is a pan-inflammatory multi-system syndrome caused by coronavirus species. Ozone is an energy-rich, naturally occurring molecule that embodies unique physical, chemical, and biological properties, suggesting a possible role in the systemic therapy of COVID-19. Ozone may exert its antiviral action, correction of oxidative stress, inhibit cytokine storm in lung, and increase oxygen delivery via vascular and hematological modulation. In conclusion, a proposal is herewith made that oxygen ozone systemic therapy are granted research consideration for COVID-19 treatment. Such therapeutic approach may then be found useful not only in this specific coronavirus condition, but also in a number of human lipid envelope viral pathogenic infection, and importantly for the future coronavirus epidemic that are certain to emerge. And thank you.
Thank you so much, Dr. Obeid. I think that's amazing. Yeah, an amazing lecture. I mean, amazing presentation, and a lot of information. Probably not enough time to present all of the information that you have in your mind, for sure. Probably you have more to show us, maybe in another opportunity. I hope to hear you again, and I hope to learn more about the ozone therapy, not only ozone and COVID-19, but about ozone and other therapies, especially in orthopedics and other maybe facial aesthetics, because we can see that the people they are using for rejuvenation, as you said, and I think that's an amazing area. I have one question about the auto hemotherapy that you said. You said about you told us about auto hemotherapy, but what's the ratio between blood and ozone to use in our patients?
Ozone
the percentage.
Yes, we have a lot of way to use ozone in therapy. The main one is ozone autohemotherapy, that we can draw a blood from a patient, like in a bag, a bag of blood donor, and then mix the gas, it's like oxygen, with the blood, and then it gives a red blood, and then we put it in the IV for the patient. This is the major ozone autohemotherapy, and we also can consider as ozonated normal saline that we can induce ozone, because the affinity of water to ozone is more than the affinity of water to oxygen. All we know that oxygen is dissolved in in some parts in water or in normal saline. But the
Mhm.
affinity of ozone is more than oxygen. So when we pass the ozone in normal saline, the normal saline absorbs some of ozone with really with sure as some concentration that we can put it in the IV for the patient, and we can and we can control the effect of ozone as a dose dependent, because if we want to increase immunity, we can reduce the ozone level, and if you want to suppress the cytokines storm, we can increase the ozone level, and also the same for blood and the same for other diseases. Also, we can consider as rectal insufflation. It used because if there is a problem in IV, because when inject ozone in by rectally, the veins surrounding the abdomen will absorb about 25% of ozone therapy. So we can also take the benefits of ozone rectally. Also, we have sometimes we use ozone in high concentration as a antiviral or antibacterial
Antiviral. Oh, okay.
as topical use.
Mhm. So when you say inside of the sodium chloride, probably it's about how many cc when you get the bag of sodium chloride, and how many cc do you apply inside of the sodium chloride for the patient in 500 ml of sodium chloride?
500.
500 ml, a bag of 500 ml.
Okay, we usually in 1 liter.
How many cc?
Okay, in 1 liter we put 100 cc in 1 liter. So if you want
1 liter, 100 cc. Okay.
But if normal,
That's a lot of ozone. Yeah.
of
No?
medical, of medical
That's a
ozone.
high, that's a high concentration of ozone, right?
Sorry.
Is it a right? It's a high concentration, right, of ozone for 1 liter.
For
1000
liter,
cc.
100 cc, yes, it's high concentration, but not all the ozone will dissolve in this water.
I see.
Yeah.
I'm very interested about this field because I like we have many studies about the ozone versus bacteria, and then we know that ozone can destroy the wall from the bacterial wall, and for sure if your ozone can destroy the bacterial wall, the ozone will destroy the cellular membrane as well, and it's like if we can destroy the cellular membrane, is it a possibility? That's why you have a lot of liberation of growth factors and cytokines, right? Is it correct? That's why you have the liberation of cytokines and growth factors from the leukocytes, especially from the leukocytes and platelets, right?
Yes, the increase of is not by destroying the cell's wall. It's only increase the secretion of these cytokines or chemokines. The same as oxygen, that all we know that oxygen, when it's near the tissue, it will not release all the oxygen inside it. So when react with ozone, that not means that the ozone will transfer to oxygen and release from red blood cells. No, it's have the affinity to also hemoglobin and decrease, and the affinity of ozone to hemoglobin, or hemoglobin to ozone is more than hemoglobin to oxygen, and it will increase the release of oxygen from red blood cells more than 40%.
Nice. Okay.
It's useful for diabetic patient and some ischemic tissues.
Yeah, to improve the vascularization. Yeah.
Yeah.
Perfect. So See, if you had some question on Facebook from our audience. Okay, do we have any questions from our audience? No? Okay. Okay. No question from the audience. Probably not yet, maybe later. And then we can answer the probably no we sorry, Dr. Obeid. He can answer it after our webinar. And I'd like to thank you so much for your presence to us today. Okay, I know it's late, 11. You need to work hard tomorrow for sure. And sorry, we have. Okay, we are not taking questions from the Facebook at this time. Okay, and then I know that you need to work hard tomorrow. And then thank you so much for your attention. Thanks so much, lecturer. And I hope to see you in the next webinar. Maybe if you do the next lecture for global summit, I hope to be your host again.
Thank you, Dr. Carlos. Nice meeting you. And thank you for all colleagues and watching us. And yes, I'm interested to do other webinar, and it's the honor that you are the host of my lecture.
Thank you so much, and congrats for your achievement.
Thank you.
Thank you.